Hi everyone, I'm very excited today to be with Dr. Deutsch and Dr. Katz. They are a couple of our key advisors on the Universal Health Information Network, and we're going to spend some time talking with them. Hi doctors, could you start with introducing yourself, please?
It's a pleasure. I am basically a pediatrician. My name is Dr. Larry Deutsch, and I have worked for a long time in Hartford, Connecticut, in the eastern U.S., and also before that in the field of biophysics and teaching. But now with public health and pediatric work, many of these issues come before us of providing patient-centered care, good documentation oriented towards the individual as well as the community, and trying to get computerization to help in those things, as well as public health monitoring and aggregation of data.
Okay, and I'm Alexandra Katz. I'm a general dentist, and I'm also a public health dentist. I did my training at NYU, and then I did my MPH at Columbia. I've worked in the state of Connecticut expanding multi-million-dollar oral health programs shortly after school from 2003 to 2010, and we were targeting areas underserved in the Hartford, New Haven, and Bridgeport communities. We worked with enhancing our electronic health records to communicate better with our medical records, and being able to talk and track quality outcomes, and to integrate interdisciplinary care between medical and dental, because we believe in treating overall health.
That's great to know. So could you tell us a bit about some of the challenges you faced in healthcare and how you overcome them?
Well, of course, in the United States, one of the primary challenges is having affordable and accessible and thorough health care. And as the whole world knows, the U.S. is behind in some areas of that sort in terms of continuity and universal care. For us, also involved in communities and doing surveillance to assess the health of, in my case, it was children, but all individuals and families that we receive. I also happen to have been a municipal official in a city council, which means also a responsibility to the community as a whole, and computerization and standardization of health records, health meaning medical and dental and all other behavioral. Automation will be immensely helpful, especially with the mobility of so many people within our city or worldwide. So this is why the attempt to create a network, national or international, would be so very helpful for the sake of individuals and the whole community and nation.
Sure. Dr. Katz?
And Dr. Deutsch and I were discussing the universal health records would be instrumental in having patients being able to access their healthcare records everywhere, and for also doctors and providers to be able to have everything at their fingertips. Problem lists, medications, disease history, family history. That's instrumental in growth and sustainability, and to preserve the health of our country and our patients.
Sure. And we were talking right before and while preparing for the conversation, and you mentioned about the work you've done on
Yes.
being an integrated system some time
Yes.
ago.
Well,
Could you tell a bit about
yeah,
that?
well, we reason that if a family or in particular a child lives in a certain urban area, let's say, they may migrate from one healthcare institution to another, a community health center like where we're sitting, a hospital, a personal private office of a doctor or a nurse, a public health clinic. And so it seems very simple, doesn't it, to have nowadays a network of health records that, with confidentiality, which we think can certainly be managed, the patient or the family can access these records, whether it is simple as immunization records for travel, or problem lists, other kinds of things that any provider of health must know, not just a parent, but a nurse, a doctor, a dentist. And we created with public funding at that time, what we hoped would be a public domain record, just like in the U.S. there's an Indian Health Service and a Veterans Administration, which seem to have computers that work well across many locations. And we reasoned that in a city like Hartford or even beyond, you would have secure networked computers that would have those personal records and easy to provide a printout for a parent who wants a health passport, which has many countries of the world have a written health passport that a parent can or anyone can consult when they need medical backgrounds. And it should be economical too, instead of wasting so much money duplicating services.
Right. Yeah, it was just fascinating finding out about the work you've done, because we're keeping in mind some of the same principles while putting together UNHIN.
Right.
And it's a tough project, so I think it's more in the execution. The idea's been there, we want to do it, but it's more about how we execute on it.
Exactly. We found here that many times there was competition among corporations designing health records, so that interfacing and interoperability was a much larger problem than I ever believed in beginning this
Sure.
project, I must say. And even to this day, we have very poor communication for people who shift from one health provider to another.
Absolutely, yeah, absolutely.
So electronic health records are get blamed a lot as well, right, for problems. And
That's right.
there's numerous research articles which I've read which talk about electronic health records being blamed for physician burnout, and also being blamed at times for the way treatment is provided. I wanted to get some of your inputs on that. Do you agree with that? And what's been your experience?
I think I part agree with that. I grew up, or I was trained with the electronic records, but I also had the experience using paper records.
Sure.
It definitely is much easier in terms of legibility. I can actually read what the previous doctor wrote, in terms of using EHR versus paper records. And also I'm able to access our medical records to see if there's any medical conditions that could impact their visit, and also see medications. The downside about it is that, as an administrator and as a clinician, I've been faced with productivity expectations, also compliance guidelines and record keeping, and also quality measures, because we are a federally qualified health center, and we have to track certain things in our EHR. So I can also agree that as providers, as doctors, there is burnout because of all the check boxes that we have to do. Oftentimes we're meant to take our work home and finish our records at home. So it is a challenge for clinicians, and I can speak on that because I practice also.
It's just one simple thing to represent graphically. We have many doctors, they enter records this way. And you can imagine it's very time consuming rather than more efficiently. And they have to do so that way rather than just dictating onto a cell phone or anything, where the record can get transcribed quickly, I think, either with coding for diagnostic or procedural coding, or from free text, and then parsed, which as an engineer I'm certain can be done, as time goes by. This would remove some of the obstacles, apart from Dr. Katz's comments that you have to certify that you've asked this, you've done that, you've had a certain kind of preventive health care, which you do, but then you must document.
Sure. And one of the things we're doing is talking with as many physicians as we can, and keeping in mind the challenges we have for electronic health records. I like to ask this question: do you feel paper works better in some ways, or are electronic health records essential?
I think electronic health records is essential.
So there's no going back, right?
No, there's absolutely no going back.
So
Actually, I'm making every practice that I've been to and grown, I've gone paperless.
Sure.
Yeah.
So what are some of the improvements? If I were to ask you, what are the top 3 or 5 improvements that you'd like to see in electronic health record systems, which you think would make them easier to use and would help deliver their full promise?
First and foremost, as I mentioned prior, being able to talk to other disciplines of medicine, especially in oral health, we'd want to make sure we were able to communicate with their OB, to make sure that the pregnant women have cleanings during their time of pregnancy. It's very important. because we know that dental disease is linked to other medical episodes. Also with pediatricians, we want to make sure that we communicate with our pediatricians and be able to send them a message through HR to make sure that their kids have the first dental exam by age 1 of their birthday. And those are just quick examples, and Dr. Deutsch, you can piggyback
So I think
on
what
that.
you talk about is interoperability.
Interoperability,
just-
right,
yeah,
and being able to talk.
Yes,
Yes.
not just interoperability between, let's say, a radiology system and let's say a lab system, but you're talking about a holistic record where you have dental and you've got medical, all of
Right.
it's coalescing into a single platform.
right.
Right. For example, let's say I'm doing a surgery on a patient and I see that their blood pressure is abnormal or abnormally high. I would like to be able to send like an e-message to
Right.
their internal medicine and get a clearance, or say, what recommendations could we have, or could we tailor their treatment.
Right. And I think implicit in some of this is having a single universal system, whether it be a national healthcare system or something which is truly patient-centered or family-centered and not profit-centered by separate corporations that, in my experience, sometimes are private about sharing information. Because then it may benefit a corporation as it grows or doesn't grow, but I think it's harmful to a family and patient when there are these shifts, mergers and acquisitions, which I'm sure you
Yes.
know are not always smooth in terms of information systems, and most of all the healthcare for an individual who has to switch one provider to another. You lose the personal touch where the computer should be an assistant, not blockage. Right?
So you mentioned patient-centric healthcare a couple of times while you were talking. So for the benefit of the audience, could you talk a bit about that? What is patient-centric healthcare? I think it helps to define it because the general public doesn't necessarily understand it fully like physicians do.
Well, it means hopefully a consistent provider of healthcare. If you go in and you see a dentist or a nurse or a doctor that you have known, the interaction is much facilitated and friendly. If it's on a paper chart or a computer with a new person, that makes it more difficult, of course. So patient-centered means that you try to provide continuity and consistency as an element of primary care, first and foremost. Even in surgical care or dental care, to see the same competent provider is always helpful to any of us personally. So patient-centered care is a watchword, let alone compassionate care, good quality care with modern data. A computer system very easily can incorporate the latest in journal articles and references in a way that's helpful on the spot, unlike with paper records and so on where you may have to look at home that night.
And studies have shown that when patients are more involved in their care and have access to their records and they're more motivated and they heal faster.
That's right.
It's very important for patients to understand the etiology of disease, what could transpire if they didn't follow up, or if they did, and what the next steps are.
Yeah.
Right.
That's what I see as patient-centered care.
Sure.
And I think that's the next wave. I mean, a lot of our organizations were faced with new demands of patient satisfaction, and that's a big healthcare challenge.
Right.
So
Patients want to be involved.
To involve patients properly and implement patient-centered care the way you described, do you feel it's essential to share health information regarding patients with them? So should people have access to their own health records?
Absolutely.
Certainly.
Yeah.
Sure.
Certainly. And maybe be even in possession of it, so that I'm familiar in some parts of the world, there is literally, as I mentioned, a health passport that has not only the immunization record, which should be able to be standardized, but the problem list, as we mentioned, the history of, let's say, chronic conditions and certain laboratory measurements and so on. All this can be universal, international, with some standardization, which we have only gone part way to. And whether that patient record is in a little passbook made of paper or even on a flash drive, I foresee that you hand it to someone and he or she can feel in some control of that record, rather than having it offered some government installation in the nation's capital.
Right.
With confidence.
Mhm. And I think that's where, to me, when there's lack of interoperability between
Right.
health systems, it feels like a stumbling block, because if
Right.
they're not interoperating and you can't have a common patient record, you're not able to provide that to the patient as well.
Exactly.
Would you agree with that?
Absolutely.
Mm.
We also, Dr. Deutsch and I were talking about patients that have just been released from prison.
Mhm.
That's right.
And
Sure.
we can talk about
Right.
that, how they're given their medications.
Mhm.
So when they're released from prison, they don't know what medications they're on.
Right.
You know, they don't have
That's
access
because
to that.
they don't even know what they were being
They don't even
given.
know what they're
Yes,
being given.
Yes.
Exactly. It's unfair to them and to everyone else when medical care has to be duplicated or it's unsuccessful. And this goes not only for people released from prison, which sometimes is justified and sometimes not, but let's say for elderly or parents that may have several children. And it's so very helpful to give them a sense of knowledge, reading, and participation in the care.
Sure.
Many people can't remember their medications and so on. This is not to blame them. It's to
I agree. I mean, I don't
Yes.
remember my medications, honestly.
Right. And-
I had an example, and for yourself, for my age group, maybe you don't care so much about it. But when my child, whenever you have a child, you have to make a lot more patient visits.
Right.
So my child had got, my eldest son had got medication for an allergic reaction a year
Right.
ago,
Mhm.
and then we moved cities. And the new
Right.
city, I didn't have the record, right?
Right.
Of
And
course.
you're not going to remember that
yes,
if you
I
have a
did
lot of
not remember
children.
it.
Right.
And so when the doctor wanted to know, because they wanted to know if he's had a possible reaction, I actually could not obtain the previous record,
That's
Right.
right.
because I had to call the healthcare practice. They finally faxed some records to me, but they said they don't keep the prescription records. And I
Right.
have to go to the pharmacy, so we
Right.
couldn't get that.
Right.
Right.
And sometimes, especially for people who may be disabled, this is a very great obstacle, and it should be. We think the technical system should be able to respond to those needs with their participation. And again, I must say that when you have a largely fragmented and privatized system, the competition sometimes overwhelms the need to cooperate, share information for the sake of the patients and the family.
Sure.
And that means to me, I must say, a national healthcare system with universal insurance and cooperation rather than segmentation into so many different corporations. That's my view.
We're living longer in
Yes.
the U.S.
Mhm.
Yes.
And our parents are living till 90s, 100. You know, the children are going to be the caregivers.
Right.
Yes.
It's very important for us to know what medications they're on, their disease history, their you know, past surgeries. Oftentimes our parents don't share that with us now, but later on, as their caregivers, we need that.
That's right. That's
Yeah.
absolutely right.
Right.
Yeah. So, and that's one of the key things, that's one of the main motivating factors for us while developing the Universal Health Information Network. And we spent a little time talking about that. So I wanted to get your thoughts on that. I think you shared some of them along the way, but just wanted to get that in a more consolidated fashion, I guess. So when we talk about the Universal Health Information Network, what are your thoughts on that project?
One thought I can recount a brief story that I and another family physician in the middle of the United States in Colorado formed a system that would cross borders by server connections through the internet. And for a farm worker, let's say, who worked part-time in the United States but lived in Mexico, just across the border, we thought, and it would have been a very simple task through internet, to be able to share medical records on that migrating family. And of course, people now move all around the world, and technically, we feel Universal Health Information Network is quite possible and reasonable and shouldn't even be all that costly nowadays. Am I correct?
Right.
But the benefit to the family and the economies would be immense.
You're right, because the cost of the infrastructure is laid out.
That's right.
At this stage of evolution of technology, we are in the information age. We have
Right.
an internet, mobility, internet is becoming more and more prevalent. So
Mhm.
the cost is a lot less than earlier. It's about to us, it's about using the latest technology to create
Right.
something where you can have that kind of interoperability.
And sharing experience too. I mean,
Right.
certainly I can learn from both experts here. We can all learn from each other, and a universal network for health data, but also public health aggregation would be of immense benefit. We can do it, as we say.
Sure. So what are some of the key things that you feel we need to keep in mind while developing this universal health information network. From a physician perspective, from a patient perspective, what are some of the key things that we should keep in mind?
The key thing is also being able to, again, communicating with other disciplines and other specialties.
Sure. So holistic record.
Holistic record,
Yes.
right? Portability. Also, for those of us who receive federal funding, easier access to click off requirements, and also to track quality measures. I mean, what makes it so much easier to have electronic health records is to track our clinical quality measures, which we use the EHR from. So we use certain codes or run CPT codes or ICD-10 codes, and being able to get our data from that.
Right.
You can't do that from paper.
Right.
Yeah, absolutely.
We also find that if there's a consciousness of public health needs, then it should be quite possible to aggregate records for each local area, for each segment of the population, whether it be by gender, men and women, by nationality, by race, by language spoken, and by geographic location, to find and interrupt contagion, spread of disease, find causative factors, which are different from place to place and population to population. And so the use of computers, everyone knows, is helpful to do that analysis and then target interventions. That's what I think is really a potential once we have engagement of providers and utilization of computer technology.
Sure.
Yeah, target intervention and preventative
That's right.
measures.
Yes, it's so important to preventative instead of reactive.
Right,
Of
preventive
course.
instead of reactive. That's first and foremost. So the electronic records should have templates to prompt doctors on the preventive measures they should take and recommendations.
Sure.
Right. And universal standards of quality, so that if one provider or one population lacks the quality and thoroughness of intervention, this could be discerned by an expert in technology through statistical studies and then efficacy of outcomes.
Sure.
Right?
Absolutely. Well, one of the things we want to do for sure as we develop the UNHIN is talk to physicians and listen
Right.
to you and get your inputs, so that we take the right approach, build it the right way, and make it friendly for both
Right.
physicians and for users. So thank you so much for your time. It's great talking with you.
Thank you.
It's a great
Thank you very
pleasure.
much.